Hey guys, all of you who are planning to come into the UK in the year 2023 to 2024 are in for a big treat, because here are the two massive changes that the UK government has done which will help healthcare professionals to earn more in the next year. So if you are interested in any of this, definitely watch this video all the way to the end, because I will be sharing all of this information. But if you haven't already followed me on Instagram, do follow me there, because all of these updates come much earlier on Instagram and my handle is Physiotherapy in UK. So I hope to see you there, and leave a comment if you do end up following me on Instagram. But diving right into today's content, let's just see what is the first rule that the UK government is definitely going to consider to increase the pay within the NHS right now. So the first thing that the UK government is definitely planning to do is it's trying to increase the 20-hour limit that we as people on the health and care worker visa or on the tier 2 skilled worker visa are allowed to work within the healthcare sector. Now, let me just break this down and clarify all of this for you guys out there. So just from what has been happening in the past in the UK, when you are offered a certificate of sponsorship and you apply for your work visa, whether it's a tier 2 skilled worker visa or now, because many of us come under the health and care worker visa, all of us are eligible to work for our full-time position, which is 37.5 hours per week under this particular NHS trust or employer. Now, if you want to do overtime for this particular employer, that's absolutely fine. For example, many nurses end up taking shifts over the weekends or on-call rotas, and that's completely fine. But the problem is, if you try to move to another, maybe say a healthcare home or maybe a private hospital, that's when the rule applies that you are allowed to work only for 20 additional hours per week. Now, you would say, Nikita, why would anybody do that? And well, the answer is simple. A lot of the NHS payments, definitely in terms of salary, are not covering what the basic cost of inflation is right now. We're making much lesser than the highest cost of inflation. And I think according to the recent reports, it's somewhere around 8% right now. And it's going to be in this quarter of the year. So definitely consider that. So if we are not making enough, and if you're a family of 2 or 3, then you are definitely not meeting the minimum threshold to sort of manage your rent, your expenses, including groceries, transport, and maybe childcare. So that's one of the reasons many NHS professionals, not only nurses, are looking out to carry on additional shifts while working in the UK, just so that they can meet their basic sort of requirements or their basic sort of financial needs. Now, that being said, like I explained, you could only do 20 additional hours for another employer who is not your main employer who's mentioned on the certificate of sponsorship. So this has been the rule that has been existing all this time. So now some would say, what is the second employer, Nikita? Do you have any more information about it? And the answer is yes. So the second employer could be any sort of agency or locum sort of agency where you pick up additional shifts, or it could be even another NHS trust where you're working bank. Now, this second employer doesn't essentially need to sponsor your visa, because you are still sponsored under your first employer. But what you need to remember is you can only work for this employer up to 20 hours. So if you cross the threshold of working for 20 hours a week, you will be at the risk of not receiving your indefinite leave to remain, or the ILR in the UK. Now, the ILR is sort of equivalent to the UK PR. So if you've sort of worked over the 20 hours per week barrier, when you come up to the ILR application in 5 years' time, this will be flagged up at the Home Office, and it sort of reduces or maybe also removes your chance of getting that ILR in the UK, even though you have paid all of your taxes, you've been a good citizen. Even though you've done all of that, your ILR would be at risk if you work for more than 20 hours. And all of this has been according to the past system in the UK. So now, all of this past rule was sort of modified during the COVID period, where a lot of healthcare professionals were allowed to work for more than 20 hours a week for their second employer. But this was obviously because it was a medical emergency during COVID and they obviously wanted healthcare staff. But about a year ago, that is in 2022, I think, they decided to stop that rule. And again, the sort of 20-hour cap was placed on all of the healthcare professionals. But the UK government now, and this has been a few weeks ago, so apologies for not sending this video out before, but if you have watching this video right now and it's helping you, do like this video and share it with others too. So this rule actually came out on 23rd of February, and if you are on the health and care worker visa, as so many of us are in the present situation, you are allowed to legally work for your second employer for more than 20 hours a week. So let me just break this down. Again, if you come under the skill visa category, that is if you've come under the sort of work populations of finance, IT and bits like that, you do not qualify for this. You only qualify for this rule if you are on the health and care worker visa. So for example, you are a physiotherapist, occupational therapist, nurse, audiologist, bits like that. Now, if you don't know whether you fall under the health and care visa category, then do not forget to check out my link in the description below, just because it highlights all of the professionals who are allowed to apply under this visa. But if you have already come into the UK on this visa, or if you've already been granted this visa, then you would be happy to know that you are allowed to work for more than 20 hours a week within the UK legally, provided there are a few conditions that you meet. So the first and the most important rule is that your occupation needs to be the same bit. So your second job needs to be the same occupation as your first job. So say for example, I'm a physiotherapist. I'm working 37.5 hours a week for my first employer. I will be allowed to work for more than 20 hours if I continue to be a physiotherapist for my second employer. So this is the sort of important rule that you need to remain, that you need to be in the same profession for which you've qualified. And this profession, remember again, needs to come under the health and care visa category. Now you would say, Nikita, what about the sort of jobs that fall outside the health and care worker visa category? What do I do then? Or what do I if I want to do another job? Then the answer is that you will not be allowed to work for more than 20 hours within that particular job. So you will be allowed to do 37.5 hours for your first employer and only up to 20 hours for your second employer, because this rule only applies if you are within the same profession and if you're practicing within whatever your professional boundaries are for that profession. And the second most important rule about this is that you still need to be working for your first employer who actually issued your certificate of sponsorship. So say for example, I'm working with my first employer. I need to continue working with my first employer in order for me to be able to work more than 20 hours with my second employer. I hope this is clear, but if it's not, let me know in the comments below and I will try to explain this more clearly in the future. Now, just as a word of caution, obviously this started on February 23rd, but this is a trial program at the minute by the UK Home Office. So they are just trying to sort of do this temporarily for the next 6 months. So I think the last date for this is somewhere in June or July. Do not quote me. Do check this news out for yourself. But yes, this is only for the sort of trial period right now. And I think the intention is that they may carry this forward, because obviously they know a lot of healthcare professionals are facing difficulties in terms of obviously meeting their basic requirements financially. So they may continue this in the future, but that's just a personal hunch. And obviously if they continue this, it will be very beneficial for all of us coming from other countries to sort of try and use this opportunity to meet our financial expenses within the UK for our families and for ourselves. Second bit of key information that I think is going to influence everybody, despite if you plan to consider taking additional shifts or not, is that the England government has decided to offer a 5% pay rise to all healthcare professionals. And again, do not quote me, but in their sort of news, they've sort of said it only applies to a few professionals. So we don't know whether it's going to be applied across all professionals in the NHS. But I think we will get that clarity in a few days from now. Now, again, this news came out 5 days ago. So I'm again a little bit late in sort of telling you about this, but let me just explain what's happening to you. So just to give you an understanding of what has potentially happened is, in the last year, all of us healthcare professionals working in the NHS received a one-off payment of 2% of our salaries within the month of, I think, September and October. So this was just added to our salaries in the same way. Now remember, we still had to pay tax on it. So it was not about this sort of payment being tax-free or that sort of thing. We were taxed on it. But now, obviously, with the new pay rise that has been suggested by the England government right now, they are suggesting that they want to do an additional 2% given to us for the last year. So that means that for the year 2022-2023, we would totally receive a sort of overall payment of 4% of our salaries at the year end. Now, obviously, we are in the year end right now for 2022-2023 in March. but this sort of additional payment will be given to us later. Now, please remember that all of this that I'm sharing with you is suggested by the UK government or by the England government, and a lot of the NHS unions, including the nurses, the physiotherapists, etc., need to accept this for them to actually go forward and sort of increase our pays on it. So this is all sort of in the pipeline right now. The strikes across the healthcare professionals in the UK have stopped for the minute with these sort of recommendations, because all of the unions have taken this back. Because all of the unions have taken this information back to all of their sort of smaller groups, and we are again going to vote for it or against it. So we are actually going to again have a voting system in the UK saying, are we ready to accept these sort of new terms for our pay rises? But yes, let me just give you a breakdown of what's happening in the UK right now in terms of wages for healthcare professionals. So this is the information that I've actually got through the CSP website, and I will leave the link down in the description box below. They have said that they don't expect massive changes from this particular document or this particular suggested pay rise. So hopefully this stays nearly more or less the same, but just in case you would want to check it, I will leave the link down in the description box below for you. But yes, just to help you understand, so there was a payment of 2% before, and now there'll be an additional payment of 2% for the last financial year. But for the next financial year, that is 2023-2024, they are giving us a pay rise of nearly 5%, which they predict is going to be more than the rate of inflation by the end of the year. So right now, the current rate of inflation stands at 8% for this quarter. So let me just explain to you what really does that mean for you guys. So again, just to sort of give you a quick example of what this would potentially look like is, say you are joining at a band 5 level. In the year 2022-2023, your salary would have just been somewhere between £25,000, and now your salary is going to be bumped up to £28,400, which is fabulous, because that's like 3,000 additional pounds for you in the year. But do remember that this is going to be taxed in the next year. I will be making a detailed video about this in the future, and let me know if you want this video sooner rather than later. But I'm just waiting for all of the sort of unions to agree on this, and for all of this news to be officially spread out, saying that this is the pay rise that all healthcare professionals are going to receive in the year 2023-2024. But if you've liked this video and if you've liked this news so far, do not forget to like and subscribe to my channel, guys. Take care. Bye.